Hello everyone, MedicoExpert with world-renowned hematologist Dr. Puneet Jain is here on Facebook live session to create an awareness about various blood cancer. MedicoExpert is a global virtual hospital that connects you and provide with surgical and medical intervention in India as well as overseas. We have a network of more than 150 multi-speciality hospital, and hence we are able to give you the access for more than 1500 super specialist doctors over 58 specialties. We not only provide our patients with the best of the treatment options but also deliver to venture the healthcare in African subcontinent. Having served more than 65,000 of the patients, we provide you a comprehensive and patient-centric approach that gives you the best of the treatment options, the best of the doctors, and the best infrastructure for your specific requirement. The main offerings of MedicoExperts are: we conduct surgical and OPD camps, medical tourism, online consultation, health checkups and wellness tools packages. We also work with Collaborate and the government to reduce the healthcare spending. Talking about Dr. Puneet Jain, Dr. Puneet Jain is a consultant hematologist, Hemato-Oncologist and bone marrow transplant physician at Apollo Hospital, Navi Mumbai. Dr. Puneet Jain also holds an additional fellowship and managing all the leukemias from Houston, US. His main special interest areas is treating all the blood cancers like leukemia, lymphoma and multiple myelomas. In addition to this, he also conducts autologous and allogenic bone marrow transplant in various diseases like thalassemia, multiple myeloma and immunodeficiency disorders and several leukemias. Dr. Puneet Jain is also a recipient of ASH Abstract Achievement Award on analysis of 550 adult patients on leukemia, and also holds a membership in various associations like Indian Medical Association, Indian Society of Hematology and Transfusion Medicines and Mumbai Hematologist Group. We welcome Dr. Puneet Jain on board. So moving ahead, I'll request Dr. Puneet Jain to tell us more about blood cancer.
So cancers that involve the cells and the organs that form the blood are called as blood cancers.
Okay, so then there will be various different kinds of blood cancer also?
Yes, there are a lot of types of blood cancers, but we divide it into three common blood cancers, that is leukemias, then there is lymphomas, and the third that is myelomas, plasma cell neoplasms. These are all different types of cells of the blood. So leukemias, lymphomas and multiple myelomas or plasma cell neoplasms.
So what is the difference, like what is leukemia, lymphoma and multiple myeloma? What is the difference between these cancers?
So it depends on the type of the cells that is affected or the area where it is affected. Diseases that originate in the bone marrows are predominantly leukemias, and they come out into the bloodstream. Lymphomas are something which are many times limited to the lymph nodes of your organs, but of course they can spread out into the bone. But if they come out into the blood, we call them as leukemic phase of lymphomas. And myelomas, again, these are cancers of the plasma cells which originate in the bone marrow, but yes, they can come out in the blood too.
Okay, so we have commonly heard like leukemia is the most common blood cancer we hear about every time. So what is leukemia cancer also, and what are the different types?
So I would like to correct that statement. Acute leukemias and chronic leukemias.
Okay.
Acute leukemias are much more aggressive. They need much more aggressive therapy. Chronic leukemias, depending on the stage they are in, we may just treat them with tablets, or sometimes they require chemotherapy. But chronic leukemias are more commoner than acute leukemias.
Okay. So these cancer, like any particular reason why people have blood cancer, leukemia, lymphoma and multiple myeloma?
So
why?
There are certain environmental factors which definitely play a part, but predominantly, and in fact it's mutational. There are genes which are damaged. There are mutations that occur in your body which give rise to these types of cells. It could be deletion 17p or certain mutations in your body which cause proliferation, excessive proliferation, and a disease, like it could be a lymphoma, myeloma, or a leukemia, whatever. But it's genetic. Genetic does not mean inheriting from your parents or something. It's the mutations that develop, which can be there, but it is proliferating.
Okay, so you said just that there are some environmental factors also that may cause the blood cancer. So we also, when we talk to patients, usually patients say that it's a myth that leukemia is due to some bacteria, germs or something like that.
It's actually there are certain lymphomas which are attributed to certain bacteria, certain viruses. I mean, mainly it's the lymphomas that can be a part. Less likely a leukemia and a myeloma, but it's the lymphomas, certain types. Certain viruses make you immunodeficient, and then you tend to develop those lymphomas. Certain infections can cause excessive proliferation of lymph glands, and then ultimately they develop a chronic inflammation and a lymphoma. So there are lymphomas which are more attributed to these things. Leukemia's direct correlation with viruses and infection is less because they're predominantly mutational.
Okay. Okay, so how and when a patient or a person will come to know that it is something related to blood cancer? So what are the common symptoms that people will understand that it is related to blood cancer?
So there are two ways you can have a diagnosis of a leukemia, lymphoma, or anything. Basically, chronic conditions or sometimes acute conditions also, you go for a routine health checkup and the doctor tells you that your blood counts are very low. You may have a normal white blood cell count is anywhere between 4 to 10,000. So you may have a white cell count of very low, could be 2,000 to as low as 800 and no symptoms, or you can have a white blood cell count of 1 lakh plus instead of 11,000, and you may have no symptoms. And these might be the early days. Simultaneously, you may have features of weight loss, excessive weight loss. You're eating well, but you're losing weight. You have high-grade fevers. You're getting swellings and all over your body, in your glands, in your neck. You have unexplained situations where you find that your blood counts were high, but then at the same time you have symptoms, recurrent infections, weight loss, fever. These are the signs you should be looking at. Myelomas are a little different. They may present with just a low hemoglobin and anemia, features of fatigue. You may have a high paraprotein in the blood, and you may have a renal failure, or you may even present with bony fractures because they damage your bones and the bones become weak and you tend to have fractures. So these are just the telltale signs, either just a routine health checkup revealing low blood counts or high blood counts or low hemoglobin or platelet or something, and at the same time symptoms with fever, weight loss, glands, and so on.
So when we talk about these symptoms, are these symptoms gender specific also? Sometimes like maybe for the girls or for the ladies are different, and then for the men the symptoms are different?
No, these symptoms they usually are not gender specific. They'll present in the same way.
Okay.
Excessive bleeding might be an extra manifestation in heavy menorrhagia, or heavy periods might be an extra manifestation if your platelets are low in a lady.
Okay, that's it. So after a common blood test, one is going through and then understanding the white blood cells are high or low, there are other set of investigations also that one has to undergo for understanding these are the blood related to blood cancer. So what are these investigations?
So obviously you will need an expert hematologist or a hemato-oncologist to be handling such situations. Routinely it's just the blood count that will be done by your physician or whoever does your health checkup, and subsequently to confirm, sometimes we need to do more invasive tests, not always, but sometimes, or majority of the time, we need to do a bone marrow examination. We put in a needle in the bone, and it's actually a 5-10 minutes procedure and an OPD procedure, outpatient procedure, and then we do a lot of mutational analysis to understand the type of the disease that we have, flow cytometry, karyotype, and sometimes NGS, or what we call as a gene scan, to know the type of mutation. Of course, these all tests are costly, so we limit what is really needed and what is mandatory.
Okay. So, what is the common age group, or usually people get into suffering from the blood cancer? Is there a particular age group?
So children can get more commonly leukemias in mainly ALLs, acute lymphoblastic leukemias. Acute lymphoblastic leukemias in adults is lower down the list. Lymphomas are commoner in the elderly age group. Myelomas are again commoner in the 60s or plus. But yes, we are beginning to see a lot of young age groups, leukemias and lymphomas also, myelomas also. So I would say that it's acute leukemias are more common in as a blood disease in ALL, especially in children. Adults, it is the chronic leukemias which tend to do more, CMLs, chronic myeloid, chronic lymphocytic leukemias. Myelomas occur in the age group of 60, 70, but yes, younger people also begin to get that.
Okay, so when you talk about children are mainly getting leukemia, is there a possibility that children get treatment or the better chances of cure than as compared to the adult?
Of course, first thing is the type of the leukemia. Sometimes certain leukemias carry very bad mutations, so they may do bad irrespective what age group you are in. Also, some leukemias respond badly to certain treatments, so that is another factors. We look at a lot of other factors too, but children tend to do better because of several factors. One is their ability to metabolize and break down the treatment, and their biological response is such. Overall, regimens that were used in children were stronger in comparison to adults, especially in leukemia, especially in acute lymphoblastic leukemia. So nowadays we tend to use what we call as pediatric inspired regimens in adult leukemia, especially in ALLs, acute lymphoblastic leukemias. There are a lot of targeted mutations and drugs that are coming in which are helping target those specific mutations. Of course, they are very costly, but that has helped in trying to achieve a better remission. But children tend to, yes, overall do better because of the ability to respond better in comparison to the same disease in or a type of leukemia in an adult.
Okay, so does this all the blood cancer spread? Can spread again and again to the body?
In the same patient, you mean?
Yeah.
Okay. Yes. If I would correct it, saying that once it gets cured, can it come back again?
Yeah.
Yes, it can. We call it a situation which is called as a relapse of the disease. Again, as I said, depending on the type of mutation, the type of treatment, the complete treatment completed or not, timely treatment, a lot of factors matter, and the type of disease that you're dealing with, acute leukemias, lymphomas, myelomas, they can relapse. Sometimes even remain refractory to any kind of treatment.
Okay, so what are the risk factors for the blood cancer, like mainly for leukemia? What are the risk factors?
So risk factors, they are mainly if I would say that if you have a family member of a malignancy or a cancer in your family, you should definitely get yourself screened, so that sometimes some things are picked up just on routine health checkup. You may not necessarily wait for the symptoms to develop. So it's good to get a health checkup done. In fact, irrespective whether you have a family of cancer or not, there are age groups at which everybody should get a regular health checkup, be it a lady, be it a man, be it children. You need to visit your doctors to be doing basic blood workups. But if you have a family member with a history of cancer, you definitely want to be seen at least very regularly.
Okay, so what are now the available treatment options for treating the blood cancer?
Oh, that's a very wide question, but yes, depending on the type of leukemia, some chronic leukemias, we just use targeted therapy, like just keeping a pill, something which required very aggressive treatment 25 to 30 years back, 25 years back. Now we just try and give some small pills which we call as targeted therapies or TKIs in chronic myeloid leukemia. Certain drugs require aggressive treatment, admitting the patient to the ward, staying in the hospital for months. Sometimes they require bone marrow transplants for ensuring a longer disease-free remission. So it's disease, depending on the type of the disease we treat.
Okay, so bone marrow transplant is not always the option for this leukemia. You have different options also. For
Yes,
the treatment.
in general, in fact, for children having leukemias, we do not offer transplant unless there is a very bad mutation, persistent disease. They tend to do better. In adults, depending on the type of the leukemia, or type of mutation, or type of response, whether it's a high risk, standard risk, or low risk, or intermediate risk, we decide about the need of an allogenic transplant or an autologous transplant or whatever.
Okay, so you heard various therapy, like there is hormone therapy also, immunotherapy also.
Yes.
So what is hormone and immunotherapy?
So mainly, I can comment on immunotherapy. Immunotherapy is trying to target individual mutation, or I would say, suppose there is a type of a leukemia, and one of the proteins that is expressed on it is showing a antigen or a special marker. So there are antibodies which are targeting those markers, that if you destroy that antigen, which is probably the source of survival, you will destroy the source, and you will destroy the disease at the source. So immunotherapy, there is a lot of immunotherapy in the which is coming up, and actually that is the current, the present and the future, the immunotherapy. So there are a lot of diseases that we try and use immunotherapy to treat those, try and target those antigens, or that kind of a protein that is there in that disease.
Okay, sir, is there any role of the surgery also in the treatment of the blood cancer?
So in general, we don't operate. Unlike solid tumors, this liquid tumors, concept of liquid tumors requires a combination of chemo and immunotherapy and targeted therapy. Okay. So, but again, individual case varies, and that decision is taken at the time of seeing the patient.
Okay, so then what are the main side effects or the effect of the chemotherapy?
So chemotherapy has its side effects, yes. Fertility is damaged, does not necessarily be permanent. It could be temporary depending on the type of diseases that you use. There are common side effects. You may get nausea, you may get vomiting, you may lose a lot of hair. It can kill a lot of your normal cells, so your immunity is even lower, you're vulnerable to infections, diarrhea, and sometimes late cancers because of the chemotherapy. That can also happen.
Okay, so talking about your blood cancer, usually we have options like radiation, radiotherapy and chemotherapy. Surgery is not the mostly recommended option, or it's not there. So talking about this chemotherapy, patients are traveling from abroad to India to come to you getting the treatment. So for how long most commonly the patient has to stay in India, and if it is like multiple cycle for chemo, or like what were the interval of each cycle?
So again, that's a very wide question, but as you said, if it could be a lymphoma. So depending upon the need for chemotherapy, certain chemotherapy protocols involve one cycle once in 3 weeks or 4 weeks, and then sometimes we give 3 cycles, sometimes we give 6 cycles, and sometimes we extend it, something what you call as maintenance, wherein we give 1 to 2 cycles every 3 months or so. So certain leukemias require at least 4 to 6 months of intensive therapy. Certain leukemias require initial intensive therapy and then just maintenance therapy, taking tablets for 1 to 2 years or so. If you need a transplant, then the patient needs to be admitted in special HEPA filtered rooms to reduce the chances of infection, and then depending on the type of transplant, at least 2 months near the hospital to even 6 months or longer if the transplant is a complicated transplant. So it depends on the type of the disease that you're treating, will decide the duration of therapy and the type of therapy.
Okay, so when we talk about chemotherapy, it's mainly understand that you are going to take injections or the medicines. So these, if people are coming over here, and most commonly we hear it from people that they will go back to their country and will have 1 or 2 session, then come back again. So is there any risk factor if they go back to their country, have 1 or 2 cycle of the chemo under the guidance of the doctor like you? Then what are the risk factors that really feasible for them to go, and they should continue under the
So it all depends on the robustness of the medical facilities that is available at a particular place. I would say if you just look at our country, it's not just the metros that have everything. There are a lot of other centers coming up. Yes, sometimes for an initial diagnosis and a plan, you might want a certain center that needs, and a certain physician or a certain team of physicians that needs to be involved. But it need not necessarily be so monopolized. It's over a period of time. If a protocol can be followed at a certain place, if the system is good, they have good infrastructures, ICUs and facility for radiation and all, and there is definitely no hesitation in sending the patients across to their territory for continuation of care, and they can always come for follow-up if they feel like.
So when you talk about follow-up, do they really need to come back even after completing the complete cycle, 6-month cycle for chemo? Do they need to come back again, or it can be done virtually? Like when we talk about our platform, MedicoExperts, we do it online on our virtual platform where we are available, and the patient will send you the reports. Virtually you can see the patient. So
yes, absolutely. See, reports are something that can be assessed online, but a physical examination isn't something that should be ignored. It's not just about the reports. It's trying to talk to the patient, knowing the symptoms, the physical examination, which is always the backbone of good evaluation.
Okay, that's great. So not when we talk about these medicines also, are these chemo medicine easily available in other part of the world apart from India?
I would say that not always, because we do have there are certain medications which are more easily available in our country. Especially we have this generic market where there are alternative Indian companies that have produced those molecules which are being used in our country at a much lower price.
Okay.
So it is definitely a market here will be more accessible.
Okay, so now to summarize whatever we have done this session, can you please give us a brief summary about like when, how patient should consult a blood cancer, the time has come that, or the symptoms are there. So small brief to make understand the people over here that what is blood cancer and how it is.
So let me summarize in few words. Blood cancers are a different entity among all cancers. These are tumors of the cells or the organs that form the blood. Those tumors could be in the glands, it could be in the bone marrow, or it could be in the blood. If you look at the types, predominantly these are plasma cell neoplasms or multiple myelomas and so on, leukemias, which could be acute and chronic, and lymphomas, which could be a B cell or a T cell, and different types of lymphomas. The usual presentations, sometimes they are picked up on routine health checkup, where you may just land up with a swelling in the neck or intractable fever, persistent fever, not every fever of course, but unless it is really persistent, or intractable weight loss, or you do a CBC and your blood counts are low or high, or hemoglobin is too low, unexplainable, your platelets are too low. These are the common presentations. If you look at the treatment, there is a variety of treatment that is available depending on the type of disease that you're handling. If it could be just chemotherapy, it could be oral therapy, it could be require admission, it could require a transplant in the near future. So I want to send a message that get yourself checked regularly, especially when you have a family history and of a cancer, and of course you should get yourself evaluated regularly with your physician, even if you don't have a history of cancer in the family. Get diagnosed early so that treatment can be offered early. Thank you.
Okay, thank you so much for giving us your valuable time. I even thank you all the audiences for coming over here for this session. And once again, thank you so much, sir, for giving us your time. Your information was really useful, and I hope all the queries are being thoroughly answered. And thank you so much, sir, for giving us your time. Thank you.
My pleasure.